That was the albatross around my neck for the longest time.
Beulah Jarvis is referring to a medication she needs to treat her asthma. At $180 per inhaler, she cuts corners to make it last longer.
I was always scrambling to try to get the money to pay for it because it's something I really need. So I would stretch it out to 2 months.
Jarvis needs to budget for a variety of drugs. She's self-employed and medications often take a back seat.
It was really stressful, and there were a lot of things that I couldn't buy food-wise.
As many as 1 in 10 Canadians like Jarvis struggle to pay for the drugs they need, something Dr. Nav Persad says has serious consequences.
We have treatments for high blood pressure, treatments for diabetes, treatments for HIV/AIDS, which can, in some cases, lengthen people's life expectancy by decades.
Persad and colleagues wondered what would happen if people who couldn't afford all their medications got them free of charge. Would they keep taking them, and would their health improve? Their study looked at about 800 Ontario patients. One group received free medication. The other group had the usual access to their medication, taking it just over 26% of the time. At the end of 1 year, the group who got their drugs free had taken them 38% of the time.
Getting folks to take their medicines on time is a really complex challenge. Financial barriers are one part of that. When we take those away, things get better.
The difference we saw was not very large. It was large enough to confer a clinically important benefit, like a reduction in the complications of diabetes. We also saw a large increase in the ability to make ends meet.
My health is a bit better, so I'm able to work more.
Jarvis was part of this study and says for her, getting free medication improved both her health and her quality of life. Cass Rusi, CBC News, Toronto.